So degeneration is not structural, it's cellular inflammation in the bone. And to flip that from degeneration to regeneration, regenerative medicine and cell signaling is the way to go, because it fights inflammatory age-related change at the cellular level. And these things can help anything with inflammation. The diseases of age and the age-related diseases are all one and the same. It's accumulation of chronic inflammation. All these syndromes here have an inflammatory element, right? So anything you can do to reverse that cellular inflammation can help slow the process and potentially reverse the process. Certain infections have a chronic inflammatory basis, Lyme's, long COVID, for example. So what else can we do for cell signaling? Well, and also I should mention all the age-related diseases. If we're fighting age-related diseases, we're really fighting aging, right? Because aging is inflaming. They call it inflammaging. All right, and we have other uses: cosmetic, sexual function, bone density, muscle mass I mentioned to you earlier. Okay. All right, let's cover some peptides. This is all the craze. I'm a big peptide user. Anyone else a user? Hi, my name is Jeff, and I'm a peptide user. My wife is a peptide user. I'm a peptide user. Who's a peptide? How does that song go? You remember that song? Okay, so our dog uses peptides. Yeah, he was a little overweight, a little reticulocytes.
It is for research.
I'm serious. Yeah, he was 30% overweight. He's losing it with
That's
400
so cool.
micrograms. In any event, this was the missing element. This was a great way for people, entry level, to try something, to hack their cells with signaling. That's what peptides are doing, right? And these aren't new. Insulin's a peptide. The GLPs, originally for weight loss, are really metabolic cell signalers. They do so much. And we know that we can use peptides for musculoskeletal regeneration. I'm now including peptides in some of the things I do when I do my joint and spine work. So we know there are peptides that stimulate cartilage regeneration. So I've added that now. I'm always looking to level up for my results. But the most common peptide application for muscles and musculoskeletal are, who knows?
CB5.
Boom, you got it. A 1-2 punch, right? Let's talk about these. So you leave here, you know more than all your friends at the gym, okay? So BPC-157 stands for Body Protection Compound, right? It's perfectly named, love this. Found in gastric juice. It's been known since the 90s to improve healing. Naturally occurring. So why isn't Big Pharma doing anything with it? Can't be patented. It's natural, body makes it. You make your own. Sometimes you need a little extra. So preclinical studies showing improved tendon, ligament, and muscle healing. I have references when you get the slides later. You can look these up. We also call it the pentadecapeptide if you really want to be totally nerdy and cool, which I know there's a fine line. That means 15 amino acids long. So any 15 amino acid chain is a pentadecapeptide. This is the popular pentadecapeptide. No adverse reactions. 2 patients were tested up to 20 milligrams IV. And honestly, the highest dose I've probably gone on someone is 2 milligrams sub-Q. So no adverse reactions in 2 volunteers who probably took it accidentally IV. I don't know what happened. Anyway, it improves wound healing. I use it myself. I have some up in my room here at the hotel as part of a stack that I use, because when I stand on my feet all day at a booth and my energy is zapped by the end of the day, and I worked out at the gym this morning, I'm gonna need a little pick-me-up. So I use that. I use a low dose from day to day, and then if we do something big, if my wife and I take the grandkids to Disneyland and walk 20,000 steps 3 days in a row, I'm up dosing. I'm strategic, so you can do that. I love pentadecapeptide. It enhances growth hormone receptor expression. And we'll come back to growth hormone in a minute, but this peptide is quite useful, and it's a beneficial nitric oxide signaling. Go talk to my friend Nathan Bryan about nitric oxide and the benefits there too. All these pathways tend to merge together. We could probably take someone from every booth at the event, and we could make a cell chart about the pathways, the influence. I bet they all interact. It'd be totally cool. Anyway, you can usually use 200 to 500 micrograms, or 0.2 to 0.5 milligrams, or you can go higher. And 4 to 6 week cycle. Some people have it on longer. Subcutaneous injection anywhere. How many people have heard if you hurt your elbow and you inject near the elbow, you're going to get a better result? Okay, let's fix that. You do not. So, little physiology. When you get a subcutaneous injection, your capillary takes in the molecule. It goes into the nearest venule, which goes into the nearest vein, which goes to a bigger vein, which goes to the vena cava, which is the big vein to your heart. Your heart then redistributes it to the lungs, back to the heart, to the arterial system, and finally gets throughout your body through the capillaries. It does not go into your joint unless you inject it into the joint, and there is some evidence that might be helpful. Most people who are injecting tissues near their joint are not getting as much as they would get if they injected the more vascular areas around their belly in the middle section. Are we all smart physiology people now? Excellent. Fixing one group at a time. Let's talk about bioavailability. How many have heard about oral peptides? How many take oral peptides? I wasn't doing that to shame you. Look at the blue bars. This is linear bioavailability. How much gets into your bloodstream? If you do a subcutaneous injection, you're getting 85%. Okay? If you do intranasal, you're getting 6%. If you do sublingual, you're getting 2%. If you do oral, you're getting 4%. If you do oral liposomal, 7 or 8. Okay? If you do topical, you're not getting anything. So the red bars, by the way, are how fast stuff gets into your system. So subcutaneous is the slowest, which you kind of want. You kind of want that going throughout the day or 2 days, right? So if you do take oral peptides, BPC 157 is probably good because the gut gets it. We know that helps the gut. But other oral peptides, you have to take a high dose to get any type of benefit compared to a similar subcutaneous dose. So for those of you that are needle phobic, I know it's a challenge, but really subcutaneous is by and far the way to go with peptides. All right, I mentioned this study about BPC, but I'll keep moving on. The other one was TB500. Naturally occurring is thymosin from the thymus gland, beta-4 fragment. The synthetic version is called TB500, okay? It is naturally occurring though, and it is a major natural peptide you find in your cells, and it sequesters and builds microfilaments, sort of the scaffolding in your cells, and it's involved in cell proliferation, migration, and differentiation. So some people worry that this could actually be bad for people with cancer, and we're still trying to figure that out. We used to use this word called angiogenesis, help build new blood vessels. But now we think the right word might be angiomodulatory. It builds new blood vessels in the right environment where you need healing, and may not necessarily do that in a cancer setting. The jury's still out. We'll update you later on that. We're looking at it. Phase 1 safety data up to 1,260 milligrams intramuscular for 14 days. I don't know why they picked that dose. I think there was Big Pharma trying to do something with it, and they didn't finish up on that. And it can accelerate wound healing, bless you, cardiac repair. You got heart issues, you dealt with heart issues from COVID, you're recovering from a heart attack, whatever, TB500 is something you should definitely do cycling on and off, okay? Typical dose. These days I match it 1-to-1 with BPC, because it's usually, if you put those two together, they work well together. We'll come back to that. Different dosing depending on what you're doing, different cycling. It's easier just to match it up with the BPC, okay? And also, guess what? Thymosin beta-4 stimulates cartilage growth. So we're using it in our patients. But if you put them together, and I think a lot of you are close to my age group, remember the chocolate and the peanut butter? Mm-hmm. Anybody remember that? Thank you. Put them together, and you get this. You get what's called, it's the base of the Wolverine. Wolverine's usually 3 peptides. What's that? That is, yeah, that's, yeah, thank you. Stay after, I think we got time. All right, so Wolverine protocol, usually there's a 3rd peptide in there, and it could be KPV, which is a 3 amino acid, because there's a letter coding system, which is really great to suppress neuroinflammation, so Parkinson's, Alzheimer's, MS, etc. But also for the rest of the body, it comes from alpha melanocyte stimulating hormone. It's a fragment of a naturally occurring protein. Copper peptide, also 3 amino acids, binds copper, GHK-Cu, okay? And that is really great for suppressing inflammation and supporting longevity in the body. It's also well known for the skin, but not just the skin, okay? So you can put all those together. The rationale is you get synergy, you get the healing, you get the angiomodulation, you get a bunch of things going on. So those are typically sourced one-to-one dosing. So you usually do 250 to 500 micrograms to start daily. You can go up from there. I have patients on 2 milligrams total a day during an acute process. Like they banged up their knee really bad and they're trying to heal it quickly. And copper's not just for skin, as I said. It helps modulate the extracellular matrix, which is sort of the scaffolding in a wound. And it can be delivered topically as well. By the way, that one stings a little bit when you inject it for a few minutes. But that's okay. We're tough, right? We're biohackers. We'll go in a cold plunge. And those are cold. As I mentioned, muscle mass supports longevity, so support your muscle mass. They're great peptides in the growth hormone axis for muscle mass. And these are, they simulate or stimulate growth hormone release in different pathways. So we got MK677, which is a ghrelin. That's a protein we make, mimetic. So it increases muscle mass, and you have to watch the insulin-like growth factors and your sugar metabolism. If you're type 2 diabetic or at risk for sugar going up, you have to watch these and monitor it closely. These are called growth hormone releasing hormone analogs. So there's a hormone called growth hormone releasing hormone that stimulates growth hormone release. The endocrine system's wacky. It's got all kinds of feedback loops and stuff like this, but it supports cell division, development, muscle growth. Lots of studies on this. Another one's called CJC 1295 that does that. That also, sometimes you see CJC 1295 with DAC. Have you seen that on the websites? That's drug affinity complex. It lasts longer in the body. It extends the half-life. So it's an amplifier. We like that. And often these are put together. So you get the ipamorelin, or the simorelin, or the hexamorelin, or the tesamorelin, or one of those morelins. Or if you pronounce it morelin, you're fine. It's just not how I do it. And you see them often mixed with CJC 1295. So you have to be really careful with these. They should be like 5 days a week, at night, at bedtime, on an empty stomach, to simulate the natural release of growth hormone, which is a nighttime release. Okay? So that's how that works. So I like those for muscle gaining. We do a lot of GLPs in my practice. So if you've come in and you've lost some desired fat, we used to say weight loss, but it's fat loss. If you lost some fat and you've lost a little muscle, before you lose too much muscle, we might start you on a little ipamorelin CJC 1295 and get a little more muscle back, maintain that muscle. Of course, you gotta do the work. You gotta eat your protein, you gotta get in the gym and work hard. Let's talk about mitochondrial repair, right? Cell signaling. Well, one really important is a cell within a cell we call the mitochondria. So in high school, we were told it's the powerhouse of the cell, it makes ATP. And although that's true, that's scratching the surface. We're learning more about mitochondria all the time. If you exercise, your mitochondria has its own genes. They only come from the egg, they only come from mom, by the way. So on Mother's Day, thank your mom for the mitochondria. Mm-hmm. So you release something called MOTS-c when you exercise. It helps, it's a myokine or an exerkine, a small peptide that stimulates brain health, muscle growth, and health in general. You've heard that exercise is preventative for Alzheimer's. This is how it does it, okay? It releases MOTS-c. Well, we can simulate that by giving a little MOTS-c back as well. That's not an excuse not to exercise. All right, so we see adaptability, metabolic flexibility from this. We do mitochondrial repair. And we know that diet, exercise, and aging make you secrete your own mitochondrial peptides. But, like I said, cells get inflamed. They need some love. So we might want to hack and help them for longevity. So we like MOTS-c. There's a role in bone metabolism. I know I have some dosing here. I've been doing it now Monday, Wednesday, Friday, up to 5 milligrams. So you're taking pictures, but you're going to get a whole deck of these slides. I promise, they're free. No secrets. Anyway, it relieves hyperglycemia and gestational diabetes. That's good, right? Reduces blood pressure, elevated blood pressure. It helps with an energy, endurance, and stamina. Of course, exercise does that. May promote muscle mass, assists in weight management, reduces inflammation. But the other mitochondrial peptide we're talking about today, and there are others, but it's called SS31. SS31 helps repair the membrane of the mitochondria. So I like to do, if someone needs a mitochondrial repair stack, I like to do SS31 first, because you close the doors and windows before you turn on the air conditioning. So I want to seal the mitochondria, seal the battery, separate the cathode and the anode for any electrical engineers in the room, so you can get the best out of your MOTS-c. So I do a month of SS31, it's a little pricier, and then the MOTS-c. So we know this helps with wound repair, it reduces reactive oxygen species. SS31 ameliorates kidney disease, ameliorates means make better. Improves diabetes, Alzheimer's progression can be stopped, supports longevity, that's why we're here at this talk, or this meeting maybe. Improves cardiovascular health, brain injury, and older adult skeletal muscle, another way to support your muscles. And again, muscles are really the longevity organ, muscles and bones, your structures. As long as you can adapt to move, your body will force survival for longevity. So muscles and bones, focus, if you could do nothing else, focus on that, okay? So I do some higher dose protocols if you're post-COVID. A lot of people who have ADD, ADHD, we've gotten them off their Vyvanse and Adderall using a mitochondrial repair. So it's a long-term benefit because some of those drugs can actually increase the risk of dementia. Follistatin is a separate route to muscle gain. Follistatin 344 is one of the synthetic fragments you can use to stimulate that. It's through a different mechanism. I use that only for people who are really struggling and didn't respond to the other things. This is an animal with multiple copies of the follistatin gene. So you can, you're not gonna look like this unless you go crazy. But there's a company, you have to go out of the country and they'll actually inject a circle of DNA with the follistatin gene. So it's a genetic modification. I'm not into that personally yet, but you can just take the peptide fragment and control it, like how much you get and how long it lasts. And then I use things, when we're doing the cartilage regeneration procedures, I use BPC 157, TB 500, and Cartilax. It comes in a combo. You can buy it as a combo. And that helps build cartilage. And then bone health. There are tons of bone peptides. I've used them when I was a spine surgeon. I used to use bone peptides in the healing bed. There's something called bone morphogenic protein. We used to use that to stimulate the bone fusion. I'm glad I don't have to do those big surgeries anymore. And so are people that see me, I hope. Also stimulates hair growth, interestingly, and helps reverse kidney disease. Peptides, again, Big Pharma doesn't want you to know this because they probably have a more expensive synthetic route. Stimulates new blood vessel development, okay? And there are other types of peptides for bone that are not bone morphogenic proteins that are used. One of them is called Forteo. It's a drug for osteoporosis. It's a peptide. So that's what I'm for. And calcitonin is another one. It's intranasal. It's a hormone that stimulates bone growth. We have to maintain our bone. That's where most of our stem cells are. We need those guys. They're making exosomes for us. Remember that. They're making cell signaling. And bioregulators, smaller peptides that work at the very basic gland levels. Epitalon, we know this is wonderful from pineal glands. Geroprotective means protecting against age-related issues. Restores melatonin secretion, which you don't just need for sleep, you need for cell repair at nighttime. Sleep deeper, repair better. So we like epitalon. It's also used for an eye disease called retinitis pigmentosa. This is well studied. I didn't make this list on my own. I looked at the literature. So there's dosing on that we can give you. So practically speaking, if you got a musculoskeletal injury, we look at regenerative medicine, exosomes. If you are looking at a minor injury, you start with peptides. Maybe you need some muscle support. Maybe you need a little Wolverine. Everyone needs a little Wolverine in their lives. Cell signaling for anti-aging. I love a mitochondrial stack. You can do it once a year. Bioregulators, epitalon. You can do 1 month a year. Other longevity stuff. I'm on my 4th year of a GLP, low dose. My HbA1c is 5.0. I'm bragging. Why? Because I take retatrutide. Okay, love, love, love. My dog's on it, as I mentioned. Surgery avoidance. Again, we're helping people avoid surgery by helping them restore their own cartilage. Your body does the work. I just help you with the encouragement. And I love other things, like we didn't even talk about setting the stage with a diet, exercise, nutrition. That's all part of it, of course. It's not what this talk is about, but you gotta do all that. You gotta take your omega-3, your vitamin D, your probiotics, magnesium, melatonin, Longevex, and other things to keep your cells, giving them the nutrients they need that we're not getting naturally through our diet that we probably did hundreds of years ago. And you gotta have testing, you gotta do labs, you gotta check things, you gotta have something to measure before and after. Maybe you need hormone optimization. Maybe you need something for bone density. If you've seen a regenerative doctor and you're happy there, but maybe you've got a joint that's lingering, that's maybe where you talk to me. So cell signaling is improving. This is happening now. People have a great appetite for this, especially everybody in this room. And the root cause, it's a root cause approach. We're at the cell. We're not just treating a symptom. Symptoms help us figure out what's wrong with the cells and guide maybe what we do. But we're not just treating the symptoms. So many fewer side effects with the peptide. So thank you, thank you, thank you. First, if you want to know more, and we'll take questions in a second. If you want to know more, my name's Dr. Jeff, and you can see us at our booth. I want to quickly introduce real quick. Mike and Hannah will be at the booth. Stand up and have a face. They are now part of the Recelebrate team. We have Mike as our chief exosome evangelist, and Hannah is our exosome angel. Come talk to them, and they can help you. Follow us on Instagram because I need dopamine release. I need more followers, please, please, please. I'm almost at 5,000. That's at Recelebrate. And then if you want a copy of the slides,